Hi, my name is Laura Sant with the University of Idaho Extension. In this video, I am going to be sharing some information about deep breathing, including the breathing process, different types of breathing, the health benefits of deep breathing, and some deep breathing techniques. Let's get started. Before you can understand proper breathing techniques, it is important to know a little about how your body breathes. When you breathe in or inhale, the muscle on the bottom of your rib cage called your diaphragm contracts and moves downward. This allows the lungs to have room to expand. The muscles between your ribs, called the intercostal muscles, contract to pull your rib cage upward and outward. As your lungs expand, air is sucked in through your nose or mouth and travels down your trachea to your lungs. After passing through your bronchial tubes, the air finally reaches the air sacs where oxygen is passed into the bloodstream. The second phase of breathing is called expiration or exhaling. At the same time oxygen is passed into the bloodstream, carbon dioxide travels into the air sacs from the bloodstream. The diaphragm and the intercostal muscles relax, and the volume of the thoracic cavity decreases, while the pressure within it increases. As a result, the lungs contract and air is forced out as you exhale. Your nose and mouth provide two ways to breathe. Both lead to your throat, which carries oxygen into your lungs. Even so, there are important differences between nose breathing and mouth breathing. Your nose is designed to help you breathe safely, efficiently, and properly. It can do this because of its ability to filter out foreign particles. Nasal hair filters out dust, allergens, and pollen, which helps prevent them from entering your lungs. This may lower risk of allergies, hay fever, and coughing. Humidify inhaled air. Your nose warms and moisturizes the air you breathe in. This brings the air you inhale up to body temperature, making it easier for your lungs to use. Produce nitric oxygen. During nasal breathing, your nose releases nitric oxygen. This is a vasodilator, which means it helps to widen blood vessels. This can improve oxygen uptake and circulation in your body. Since your nose was specifically designed to help you breathe, nasal breathing has many advantages. Nose breathing is beneficial primarily because it allows your nasal cavities to increase airflow to arteries, veins, and nerves, slow down breathing, improve lung capacity, strengthen the diaphragm, aid your immune system, lower your risk of snoring and sleep apnea, and support the correct formation of teeth and mouth. Your mouth helps you to eat, drink, and talk. You can also use your mouth to breathe, but it doesn't have many of the unique features that your nose has for this purpose. In some cases, mouth breathing is necessary. You might need to breathe through your mouth if you have nasal congestion, a deviated septum, or small nostrils. Yet breathing primarily through your mouth is associated with some health risks. With mouth breathing, your mouth loses moisture, which can cause dry mouth. It can also increase your risk of inhaling unfiltered air, allergic reactions to allergens, asthma, bad breath, tooth decay, gum inflammation or gingivitis, snoring, sleep apnea, and teeth or jaw abnormalities. Let's explore 4 different types of breathing, how and when you likely use them. Eupnea. This is probably the type of breathing you are doing right now as you sit there. This is the breathing that occurs when you are not thinking about breathing. Also known as quiet breathing, both the diaphragm and extra intercostal muscles must contract for this type of breathing. Diaphragmatic breathing, also known as deep breathing. The diaphragm muscles must contract in this type of respiration. As the muscle contracts, breath passively leaves the lungs. Costal breathing. This type of breathing, also known as shallow breathing, uses your intercostal muscles, the muscles between your ribs. As these muscles relax, the air leaves your lungs. If you are stressed, you may be doing this type of breathing right now, or even unconsciously holding your breath. Hyperpnea, also known as forced breathing. Both inhalation and exhalation are active rather than passive due to muscle contractions. There are many health benefits to consistently practicing deep breathing. This video will discuss 6 of those health benefits. Deep breathing activates the parasympathetic nervous system, which decreases the heart rate and dilates your blood vessels, reducing your overall blood pressure. As your breathing becomes slower, your brain associates it with a state of relaxation, which causes your body to slow down other functions like digestion. By taking a moment to breathe deeply in a stressful situation, you can train your body to react in a calm manner when facing challenges at work or in your home life. This can improve your overall heart health and help you face problems with a clear head. Improve quality of life in people with asthma and chronic obstructive pulmonary disease, or COPD. Breathing exercises are a non-pharmaceutical way to help people with lung conditions such as asthma and COPD manage some aspects of their disease. In people with mild to moderate asthma, breathing exercises can help with hyperventilation symptoms, lung function, and quality of life. There currently isn't much evidence to support breathing exercises for improving asthma symptoms. Diaphragmatic breathing, slower, deeper breathing that engages the diaphragm, is often taught in COPD pulmonary rehabilitation programs to help make lungs more efficient and improve oxygen levels. Breathing and quality of life can be improved in people with COPD who practice diaphragmatic breathing, especially when used in conjunction with other interventions such as pursed lip breathing and exercise. Although the practice of breathing more deeply and intentionally seems simple enough, the American Lung Association cautions that the exercises may take time to perfect. Start slowly and don't try deep breathing when feeling breathless. Manage depression and anxiety. Chronic stress is a common problem. That stress can lead to a disruption of normal breathing rhythm and in turn contribute to anxiety and other mental health conditions. By doing mindful breath exercises, individuals can start to rebalance their breath system, which can lead to improvements in the way they think and feel. The more stressed people become, the harder it can be for them to think clearly. In one small study published in June 2017 in Frontiers in Psychology, participants attended 20 sessions teaching belly breath, another term for diaphragmatic breathing, over 8 weeks, which resulted in significantly lower levels of the stress hormone cortisol and significantly higher sustained attention rates than the control groups. Overexposure to cortisol and other stress hormones is linked to an increased risk of a variety of health issues, including depression and anxiety. Reduce tension to help with headaches. Calming the sympathetic response via deep breathing can also help you relax and reduce muscle tension. This may help with headaches in a few ways. It will reduce the tension in your neck and shoulders, which could improve headache pain. If you're more relaxed, you'll be able to rest better, which will also help you feel better. Although deep breathing probably won't help in the middle of a headache, practicing regularly or the moment you feel a headache coming on may be useful, especially when combined with medication. Relieve some symptoms of irritable bowel syndrome, or IBS. There can be digestive benefits of deep breathing. The physiological movements of the diaphragm can help relieve tension in the digestive tract and can help with gastroesophageal reflux disease, or GERD, symptoms, constipation, diarrhea, and urgency. Deep breathing may help with these symptoms because tension can interfere with good digestion. A small study published in April 2020 in the Frontiers of Psychiatry in adults with IBS that included training in progressive muscle relaxation and diaphragmatic breathing found that compared to the control, the intervention led to improvements in IBS symptoms, depression, and quality of life. Reduce the number and severity of hot flashes. High levels of cortisol, one of the fight-or-flight stress-related hormones, has been linked to hot flashes, a menopausal symptom. There is some evidence that paced breathing, deep, slow breathing at a rate of 6 to 8 breaths per minute, may help reduce hot flashes. Hot flashes can also occur as a side effect of some cancer treatments. Memorial Sloan Kettering Cancer Center recommends deep breathing exercises as a non-hormonal way to help reduce the severity and number of hot flashes due to cancer treatment. Now we're going to explore 4 deep breathing techniques. Deep breathing is a complementary therapy, meaning it works best in conjunction with other therapies, not as an alternative therapy. The good thing about deep breathing is that there are no side effects. You can access it any time of the day, and it is empowering to help reduce stress and improve focus. Diaphragmatic breathing. As a reminder, the diaphragm is a small muscle right below your lungs. If you're breathing correctly, it will contract and move downward so that your lungs can expand to take in fresh air. Upon exhalation, the opposite happens. It relaxes and slides further up your chest cavity. To engage in diaphragmatic breathing, begin with one hand over your heart and one hand over your belly. Breathe in through your nose and let the air fill your belly. Keep your hands on your heart and belly and observe how the one on your belly moves, while the one on your heart should stay the same. Draw your navel towards your spine as you exhale, as if you were blowing out birthday candles. Feel as the hand on your belly slides down to its original position. Repeat this 3 to 5 times to start, noting how you feel after each time. A standard technique for any aspiring yoga student is yogic breathing. It occurs in 3 parts. Phase 1. Sit in a chair or cross-legged and upright on the floor and relax your shoulders. Place one hand over your navel and slowly breathe into the belly. You should feel the belly expand with each breath in, deflate with each breath out. Practice this a few times. Next, move the hand up a few inches so that it is covering the bottom of the rib cage. Focus the breath into the location of the hand, expanding the ribs with each inhale, retracting them with each exhale. Practice this for about 3 to 5 breaths. Move the hand to just below the collarbone. Breathe deeply into this area and imagine the chest spreading out and withdrawing with each exhale. Do this for a few breaths. Phase 2. Connect all these motions into one breath, inhaling into the stomach, lower rib cage, then chest. Exhale in the opposite direction, first emptying the chest, then the rib cage, then the stomach. Feel free to use a hand and fill each area as you breathe in and out of it. Continue the same sequence for about a dozen rounds. These motions will feel very awkward at first, but after a few breaths, they get easier. Box breathing. Navy SEALs use this technique to stay calm and focused in tense situations. It's simple. Inhale to a count of 4, hold for 4, exhale for 4, then hold for 4. Repeat. Longer exhalations will elicit a stronger parasympathetic response. There is a variation to box breathing that more deeply relaxes the body. This technique is especially effective before sleeping. To do it, inhale to a count of 4, hold for 4, exhale for 6, hold for 2, then repeat. Try at least 6 rounds, more if necessary. 4-7-8 breathing. With this kind of breathing, you will breathe in for 4 seconds, hold your breath for 7, and exhale for 8. Start with one hand on your heart and one hand on your belly, as in the diaphragmatic breathing exercise. Count to 4 while breathing in through your nose and filling your belly. Then hold your breath as you count to 7. Finally, exhale through your mouth, emptying your lungs completely for 8 counts. Repeat 3 to 5 times or until you feel calmer. Here are some tips and tricks to try as you practice deep breathing techniques. The first is to make time for deep breathing. It may sound silly to set an alarm or timer to breathe, but it can help ensure that you're getting the great deep breathing benefits regularly. When you wake up in the morning, instead of rolling over and grabbing your phone when your alarm goes off, try for a few rounds of deep breathing exercises. The next is do it prior to or during high-stress situations. The best part about breathing for relaxation is that nobody needs to know you are doing it, so you can do it anytime, anywhere. You probably have places or situations that you know are likely to stress you out, like standing in line at the grocery store or getting stuck in traffic. Take a minute to treat your brain to that sweet, sweet oxygen before the situation escalates.